So medical writing is a very broad term, and it incorporates regulatory and comms writing. The regulatory writing is to do with getting new medicines to patients faster. And it's to do with writing up the clinical trial data, the dossiers, submitting for a license to the regulatory authority to allow prescribers to prescribe a medicine. That's the regulatory side. But the other side of medical writing is the comms side. And that's about explaining to patients and finding out more about medicines and communicating that to the wider community. So they will do things like having advisory boards and having direct to consumer information. So they're definitely working more in plain language with different target groups, not just writing for regulators. And there's overlap. There's definitely overlap between the two spheres. Both spheres are fascinating, full of amazing people, super talented, super skilled, which sounds like I'm blowing my own trumpet. And I don't mean to do that, but my peers are amazing. And I have imposter syndrome every day in the office. So yeah, medical writing is a fantastic profession. It stretches you in so many different ways. You need a plethora of skills. You have to be able to write. Your vocabulary has to be good. Your syntax, your sentence construction, obviously all has to be good. But beyond that, you need to understand people and you need to understand science, and you need to bridge the gap between those two things. And that's where I think it's a real stretch. And that's what I really love about it, because it's explaining to people, whether it's regulators or the general public, the story of a medicine. We're all storytellers, but the way we tell our stories and the stories that we tell depend on which part of medical writing you're working in. So if anyone is thinking about becoming a medical writer, absolutely do it. But go and get some good training. And AMWA's a good place to start.